I'm Ilaras. Just to start off this video with a preface, sorry if you see me blowing my nose with tissue because I have sinus. So let's get started to this video. I want to talk about mental health because it's May Mental Health Awareness Month. It's very important for us to talk about mental health because a lot of us are having mental health issues and we are being stigmatized and we being shamed for having mental health issues. I have mental health issues for quite a long time and I seek help when I was 18 years old. Currently, I'm 26 years old, so it's been 8 years. I've been seeking help for mental health. I've been on medication. I've been on all sorts of medication, you name it, I've been on it. And I've experienced a lot of episodes, a lot of meltdown. I was even warded in a psych ward before. So, to say that someone have mental health issues and cannot recover is such an understatement because we can recover, we can have not recover but more can be stable and not have any relapse. But if you relapse, is part of healing. Relapse is part of healing, and that is okay as long as you seek help. So not only the people that I know in my life, like my cousin that have mental health issues, I have friends that also have mental health issues, and I have experienced and witnessed firsthand people being restrained in psych ward for their meltdowns. And it's very devastating to see that how our mental health institution in Singapore treat mental health patients. So this is very sad that most of the nurses doesn't treat the patients right, and the cleanliness over the psych ward is not being taken care of. I have seen like the toilets being clogged, poops everywhere. You know how that we need water to clean ourselves, right? There's no water to clean ourselves. There's only tissue, and the tissue is outside the cubicle. So there's that. And shower time is at 7 a.m. And if you are late by a few minutes, like if you are late for the shower time, you are not going to be able to shower for the rest of the day. Is that fair? Is that how hospitals should be? We know that we have illnesses, that we know that we are mentally unwell at that point of time, but to treat us like animals and not having our hygiene taken care of is very downgrading and dehumanizing for us. And the stigma against working in a lot of companies, if you have mental health issues, you mean you can't work. And you get retrenched or you get fired, or you're not going to be accepted for the job and things like that. I have experienced all this, and to see that until today that mental health isn't talked about and being raised awareness about, especially like psychotic illnesses such as dissociative identity disorder, schizophrenia, BPD, borderline personality disorder, bipolar disorder, schizoaffective disorder, paranoia, and a lot more like eating disorder, anorexia, bulimia is not being talked about. And also something like postpartum disorder isn't talked about. We only talk about depression and anxiety, but even so, depression and anxiety isn't being understood by the people or by the community around us because there's still stigma about this. So I think as of right now, we should really raise awareness. We should really talk about this, because this is a very important topic to be talked about, especially in this month. It's a month that dedicated for mental health and to raise awareness. And I thought that since I've been an advocate for so long, for so many years, I decided to take a break from being an advocate for a few years now, for 2 years already. And I decided that it's time for me to speak up about it and raise awareness, and hope that people are aware that what's going on with the mental health institution in Singapore. First off, IMH, the food there is disgusting. It's not nice. It's not like any other hospital food that you can actually eat. It's actually food that you are not able to eat. It smells disgusting. And to have a good food, you have to upgrade your meals, which is expensive, which is $8 per meal. Just imagine, if you want to have 3 meals, you have to pay $24 every day. And the length of stay depends on the doctor, and sometimes you can stay up to 2 months. But the length of stay that I stayed before was 11 days in 2019 and 9 days in 2023. So it was kind of like hectic when I was first warded in 2019. It was so dirty, and then in 2023 it was the worst of my life, but I have to be patient with it, and I have to try to be nice to one of the caregiver over there, instead of the nurses, because the nurses can be very mean. There's a few nurses whereby I experienced like abuse from them, whereby they were very harsh with me, very harsh. They don't talk nicely. They look at us like we are lesser than them, and they were very hostile towards us. So a lot of people in the patient there doesn't really recover in IMH with the treatment that they give, and the doctors only sees us like 15 minutes max, or actually 10 minutes max, and then off you go, and you don't know when you're gonna get discharged. And even so, like this, because of this issue that's going on in the IMH, it has made that people with psychiatric illnesses doesn't want to go there to seek help. They kind of refrain from going there, or they will seek alternative elsewhere. And private hospitals are very expensive. There's no private hospital for mental health patient, but there's private hospital for like consultation, like for outpatient, but it's so expensive. I remember that I had this Dr. Go. He was my doctor in Kutipuat Hospital, my psychiatrist, for 6 years before he moved to Mount Elizabeth and have his own hospital, his own clinic, family psychiatry, I think. I forgot. And I called them because I would like to see my old psychiatrist back, and it's very expensive. It is $150 per hour, and every extent of 15 minutes is additional $100. So in a day, you can imagine, like, that's just the consultation. We are not going to talk about the meds, because medication can be expensive, but thankfully for me, I use my Medifund to seek consultation and get my medication, and that is the best thing that ever happened in Singapore for those that is in need of mental health help, is that there's Medifund for it. And I think for myself, I've been going through a lot of roller coaster of emotions, because my diagnosis is schizoaffective disorder, so it's a mood disorder. So to get myself better, I have to be regular with my medication. So I've been on meds 2016, but I wasn't regular with my meds as how I was since last year, because I decided to take that step to get better. So I've been regular on my meds, I've been regular with my therapy. Usually I seek therapy elsewhere than the clinic at Admiralty Medical Center, because therapy at hospitals or like government hospitals, it's very difficult to get like a very lengthy therapy and a very regular therapy, because it's like once every 3 months or once every 2 months, and you will only see them when you are on crisis. So I seek help in this place, Care Corner, if I'm not wrong. Yeah, Care Corner. And I seek help from Care Corner therapist, and I see her, my therapist Melanie, every bi-weekly. And then now I see her once every month because I am getting better. So what advice that I can give? Not really advice. I'm not someone that can give advice, but I feel like it's my place to raise awareness on this and to help those that have mental health issues, is that be regular with your medication, be regular with your checkup, be regular with your therapy. Understand that you have responsibilities like school and your career. For example, if you're a student, I hope you can actually try to explain to your teacher, and I hope and I know that teachers who can understand that mental health is important. But for work wise, you can easily be replaced. So if you prioritize your work, if you decided to have a melt, if you have a meltdown, or you have a breakdown, right, or you decided to be sick, if you tend to be sick on that particular month, or you can't work for that particular month because you are unstable, your company can replace you easily. But you have to prioritize your mental health. It's okay to be selfish, because work you can find anywhere at any time. Be patient and just know that your mental health comes first. So as of right now, I know that I don't have any job and all, because of some companies cannot accept of my mental health issues and all, which I understand. And I'm gonna try my best to find other jobs that is willing to be able to accept this, because I know that it's gonna be a long process, a long journey. But my mental health comes first, because mental health isn't just you having a breakdown or you having a meltdown or you being unstable. Some people, or most of us, tend to be suicidal. It takes our life away, you know. You know how much people struggle with suicidal ideation, that to the point that it's not just an ideation anymore, it's an attempt. And speaking of that, I went through that as well. I attempted suicide multiple times in the past. And I survived, and I was rushed to the hospital, and that's why I was warded in So take care of your mental health, be patient with yourself, be consistent with your healing process, and always remember to take your medication if you have